As an ED physician, you need to be very familiar with X-rays because you will see it and use it all the time in the ED. It's a relatively cheap machine and it provides the results very quickly. You can see the images practically instantly, especially with portable X-rays. So if a patient has some serious emergency condition, you can see some alarming findings or red flags in the X-rays. It is also available pretty much everywhere. The machine itself provides ionizing radiation, meaning there is some risk of radiation, which means the less exposure the better. It can visualize soft tissues, but the results will be very grainy and hard to read. So it's best for visualizing hard tissues like the bones. In other words, it can detect early signs of some severe and serious conditions, but it's not very specific for unserious conditions. One of the most common uses is, of course, bone fractures. If a patient presents with some serious or severe trauma and you suspect bone fractures, X-ray can be done to detect these fractures with very high sensitivity. It can also be used to detect chest or cardiac conditions like pneumothorax or pericardial effusion. Again, the sensitivity is not very high, but it can be detected. In cases of severe abdominal pain, especially with high lactate, and if the patient is constantly vomiting, they might have some abdominal conditions like bowel obstruction or bowel perforation. X-ray can be used and you will see multiple air fluid levels, which indicates bowel obstruction, or you can see air in the abdomen or air underneath the diaphragm, which indicates bowel perforation. And these are serious emergency conditions that require emergency surgery. It can also be used to detect ingestion of small metallic bodies. If a patient presents with swollen, painful, and red joints, they might have arthritis or dislocated joints, both of which can be seen using X-rays. The spinal cord itself cannot be visualized using X-rays, but the spinal column can be, so we can use it to detect the alignment of the vertebral column, and we can also see if there is any vertebral fractures. This lecture is part of the emergency medicine course. If you find it useful, you can check out the entire course in the link in the description. The course covers everything that has to do with the emergency department, including tests, imaging studies, common cases, and serious conditions. We also have a lot of cases and quizzes that you can take to test your knowledge. Just check the link in the description.